distinguished guest, Dr. Parag Biniwale sir, and to all our viewers joining us today. A very good evening to each one of you. I extend a heartfelt welcome to another enlightening episode of Gyan Pravah, a podcast series envisioned and initiated by our dynamic president, Dr. Sunita Tandulwadkar madam. Gyan Pravah, meaning flow of knowledge, was conceptualized to offer a distinctive platform for meaningful conversation not only within the realm of medicine but also exploring insight beyond it. This initiative continues to inspire and engage, fostering learning and dialogue across disciplines. I, Dr. Jyoti Banglawala, Chairperson of Ethics and Medical Legal Committee of FOGSI, am delighting to host you for episode number 311 of this reclaimed podcast. We welcome you, madam. We welcome you, Parag Biniwale sir. And we can just see this is a specially designed podcast for our chairpersons to just explore their wings. And we all know there are not like some fetal medicine or not like a PPH, not like anything. We are adding anything extra to our podcast because our viewers are not only the doctors, our viewers are the general people also. So today joining us, the remarkable figure in the field of OBGYN, Dr. Parag Biniwale, a name synonymous with women health, academics, holistic wellness and community empowerment. My sincere gratitude to our visionary president, Dr. Sunita Tandulwadkar, for creating this opportunity, giving this platform to all our chairpersons. Dr. Sunita Tandulwadkar is not just a name. She is force redefining reproductive medicine in India and beyond. From pioneering the world's first stem cell baby at the age of 45 to shaping national medical policy as our president of FOGSI 2025, and she is representing over 46,000 OBGYN consultants from across the country. She is president-elect of ISAR. Her leadership has inspired generations. As the founder of Society of Ovarian Rejuvenation, she has opened 2 new doors of hope. Through the visionary initiative of Sampurna Preconceptional Care, she is dedicated to uplifting the lives of women across India, not just medically, but holistically also. Her approach blends sincere science with soul, embodying the belief that true care begins even before life is conceived. As a visionary leader, she doesn't offer solution. She creates pathways. Madam, the podium
Thank you,
is yours.
Jyoti. Today is your day with Dr. Parag. And I'm so glad that you have chosen Parag. And I'm sure it will be, I read your topic and everything, and it will be one of the best podcast. Parag, welcome to FOGSI platform, not a FOGSI platform, but FOGSI, the core 2025 platform, where this 8 p.m. we all join. It was a marathon efforts and a task to have a non-stop, not a single day to miss out. And thanks to our support team, thanks to my 30 committee chairperson, I believe they work very hard. Whatever responsibility I have given to them, they have just owned it. I thought these are the future leaders. They should have an independent platform to perform. And I just don't wanted the Zoom meetings and webinars. And this is a fantastic podcast. They come out with one faculty and 45 minutes discussion with that faculty. Not only help them, but help me also to evolve, because every day I meet at 8 p.m. one of the faculty, 90% of the time unknown to me from different fields. It was such a beautiful journey to meet all of them. I wish the day will come when I meet each and every one of them, because there is so much achievers. These all people are, we work in such a small, tiny OBGYN factor when we see globally how much people are working in different fields. It definitely widens your horizons, it widens your vision, and it helps you to understand there is a life beyond our OBGYN as well. So thank you so much, Jyoti, for having Parag. And Parag, welcome. As a protocol, I'll be joining the viewers link, and only both of you will be showcased on the screen, and I'll be listening to both of you. So thank you, and have a
Thank you.
wonderful time
Yeah.
together.
Thank you, madam. Thank you. Learning so much from you, even from the OT you are joining for the podcast, madam. And that is the zeal. That's why all the chairperson actually doing the podcast very enthusiastically. When we see our leader is doing such a manner, so we all are so happy to do this, madam. Thank you. Thank you for gracing the occasion, madam.
Yeah. Sunita, thank you
Nice.
very much for, first of all, creating this platform. I've watched these programs number of times, and I really enjoyed the kind of interaction our chairpersons are having with leaders across various fields. And a lot of credit of this goes to you, because the concept is something which was never tapped before on our Foxy platform, and your chairpersons are executing it really well. So
Thank you.
congratulations to you and all the chairpersons, including Jyoti, of course.
Thank you. Thank you, sir.
Thank you. Thank you. Everyone at the time when we declared that, they said this is impossible game for you. Joining 360 days is a remote. I said, you don't know me.
No, no, madam.
We
Thank
are
you.
committed to the level. Thank you, but all.
Yeah,
And I
yeah.
will definitely enjoy this.
Thank
Thank
you.
you.
Thank you.
Thank you.
Thank you very much,
Thank-
madam. So we are moving to our podcast session, and today our guest is Dr. Parag Biniwale. We all in Foxy know Parag's a very cool, composed person. Actually, when I was seeing sir previously, I was just it was like how cool, how calm someone can be. He is unflappable, unflappable. I never ever seen him even making faces also, even not angry is the, I think it is the beyond this. इस जन्म में तो हमने नहीं देखा सर आपको गुस्सा होते हुए. So this is for the official introduction, because whenever we see a doctor and a gynecologist, we are just seeing the ladies, they are just shouting in the labor room, they are shouting in the OT, what we have seen before. When we saw all the man in the gynec field, we just saw just some disturbed kind of misplaced type of their perception that days when we are the student. Now, when we saw you, Jaideep sir, even Bhaskar sir, then I say, oh, gynecologists, male gynecologists, they are something different. They are actually more inclined to the women health, just because they have to cut the gender bias system of our society also. So we welcome you, sir. And for formal introduction, Dr. Parag Biniwale sir is the ICOG chairperson, and he is the senior consultant in Pune. He is PG teacher and unit head of Kamala Nehru Hospital. He is president of Menopause Society in 2018 to 22 in Pune, and president of Pune OBGYN Society in 2022 to 23. President of ISOPA Pune chapter in 24 to 26, current president of ISOPA. National website editor of Foxy in 2011 to 17. He is the peer reviewer of Journal of OBGYN of India in 2011 to 17 and Journal of Midlife Health in the same year. He was the chairperson of Young Talent Promotion Committee in the Foxy 2008 to 10. He edited 7 books and co-editor of 3 books. He has published articles in many journals, delivered orations and guest lecture more than 170 Foxy societies. He was recipient of Best Paper Prize in AICOG and MPOX. We welcome you, sir. Today we have taken not a very academic topic for you, because we all know you as an academician because you are the chairperson of the ICOG, but still we have chosen some offbeat topic for you. Our topic today for the 311 episode is the breaking barriers and perspective of a male gynecologist. So this episode where the doctor share personal anecdotes about choosing the field, why you chose the field, what type of challenges you faced, and what are the rewarding aspect you have your journey towards this OBGYN. We have taken this segment in the 3 parts. First, the busting the myths. Sometimes the people think, अरे वाह तेरे तो बड़े मजे हैं, तो gynae segment में चला गया, सब तरफ ladies ही ladies हैं. So we have to just bust some myths also. We have to just take some what you think about the branch, what you really think about the OBGYN, and the other side of speculum. Because being a ethics and medical legal committee chairperson, I have to just see with a male gynecologist what the comfort level of a woman, what a male doctor do to ensure the safe environment in his clinic, and what the tips for the other male gynecologists just to free himself from the litigation also. Nowadays, we are seeing so many litigation from the patient side. So when there is a change of gender, like when a female gynecologist is just doing examination of the female patient, there is some different thing. When a male gynecologist is doing a examination or talking to the patient, even because this is a very intimate type of subject, and when we are talking and we have to just build a trust, there is a trust issue also. So we have to just see the medical legal part also. What the take home message from your side? So welcome you, sir, for the breaking barriers and perception. So first we want some confession from you. What the first thing which drew you as a man to the field of obstetric and gynecologist? Means in the MBBS days, when you just have the phase to choose the field, what the first thing you just thought about the gynec, and what there is the any defined moment when you just think, yes, yeah, this is the branch I want to go.
All right. First of all, Jyoti, thank you very much for having me here. It's indeed an honor to be on the Gyan Pravah platform. Something you all are doing.
It is our honor to have you in this platform.
Thank you. Thank you. Now, the story dates back to 1986. I, very vividly remember my first term as a second year MBBS student in the Department of Obstetrics and Gynecology. And we were posted under Dr. A.V. Umranikar. Now, Dr. A.V. Umranikar, just for information of the viewers, was a very senior, popular OBGYN specialist from Pune. He was past vice president of FOGSI, and of course, he was the chairperson of medical disorders in pregnancy committee in the 90s. And in fact, Dr. Umranikar was the one who took POJs to what it is today. Now, when I was as a 18 or a 19-year-old, I was attending my first term in OBGYN. Sir himself was a fantastic personality. If you looked at him, you really wanted to be like him because he was a polished gentleman. He was a soft-spoken person. At the same time, he was an excellent clinician and a wonderful surgeon. So he was probably the first person who made a mark in my life as when I was doing this particular term. Now, Jyoti, if you visit places in the north or even in the south, there are a lot of women gynecologists, and you hardly get to see one or two OBGYNs. But in Maharashtra, things are a little different. Even in the city of Pune, we have had very senior male gynecologists who were the rulers, I should say. We had late Professor Anjanelu, who was one of the doyens of OBGYN in the city of Pune. Then there was the late Dr. H.N. Fadnis, who was also a very popular teacher in the government medical college. And when we were undergraduate students, in fact, two of the units had male head of the units. So in Maharashtra, somehow it's not uncommon, I should say, to have a male taking OBGYN. So I give full credit to Dr. A.V. Umranikar because, in that impressionable age, I thought I want to be like him. And I probably, that is how I started attending OBGYN more frequently, and I used to attend all the emergencies. And the second person I give credit to is Dr. Uma Wankhede. Dr. Uma is a senior professor now from Pune, and she was a postgraduate student at that time, and I was an undergraduate student. And practically, she taught me everything. So my first delivery, which I conducted, was when I was in the second MBBS as an undergraduate student. And this is all thanks to Dr. Uma, who literally taught me how to be patient, how to talk to the patient, how to conduct the delivery, and of course how to suture episiotomy. So when I did my first delivery, I thought this is something I would certainly like to do. Of course, it comes with the flip side. Probably is there are late nights, or in Sassoon there were emergencies where we could not even sleep for 24 or even 48 hours. But still, I somehow liked the branch, and that is how my liking for the subject of OBGYN started. In fact, one of my teachers did ask me in the second MBBS, whether I want to do post-graduation in OBGYN, and very promptly I said, yes, I want to do PG in OBGYN. I don't know what made me say that, but I just followed that passion and then ended up
So
entering the department of OBGYN as a PG student later.
from the second prof, you just thought about the OBGYN. As you said, actually in the Maharashtra and in the East, there is a culture of male gynecologists, but in the North and South, there are less male gynecologists. Even in the Indore, the Dr. Kelkar, Dr. Mule, Dr. Jankalwala, all the HODs, all the unit heads were the male when I was studying. And even the Dr. Jankalwala is a very renowned name in India. And he headed Indore for so long. And as I have seen as a patient, as a student, as a family friend, I have seen still means my mother Jangalwala sir ke paas hi jane ka hai aur kahin nahi jane ka. We have seen those times. Now, actually, as you actually confronted it in Maharashtra, it is not uncommon, but still, that time in the second prof or in the final year, that time means you were unmarried that time. So mother, father, family, colleagues, patients, even means what you face resistance from their side. And if means your mother or father or family, even the friends that tease you. So how did you navigate them also?
Okay, now my father is a general practitioner. He has done his MBBS from the same BJ Medical College, and even at the age of 92, today he's visiting his clinic for 2 hours a day. So, being a doctor himself, he never had any objection to me choosing any career. My mother is a homemaker, but then she has always supported whatever we wanted to do. So when I talked to both of them saying that I wish to pursue OBGYN as my postgraduate career, both of them were very, very supportive. And somehow in our college, there were quite a few who were interested in the subject. So in fact, at that time, the Department of OBGYN had about 60% male doctors as the staff as compared to 40% women. So the acceptance was good,
Good
and
acceptance.
I didn't face any gender bias as such as far as
So
the
you must have
department
not
was
faced
concerned.
any assumptions or stereotypes from the society.
Not at
ऐसे
all.
भी
Not at
our
all.
Marathi society, Maharashtra society is liberated. It is actually one of the liberated societies if we see the Maharashtra as in
Yes.
comparison. Even in the front of education, Maharashtra, Bengal, Kerala, we see the women education is at the higher rank. So, but what has been your most surprising learning about women's health? Because when I entered into OBGYN, I was just thinking OBGYN means just delivering the baby, suturing the episiotomy, doing cesarean section, most of the time screaming, most of the time just say the female to just push. This was my conception when I was in internship. But when I became the consultant and I was saying, no, this is far beyond this. Most of the time, 15-20 patient के attendant आके they are just asking about the homely affair also कि लड़की की शादी करना है मैडम ये लड़का देख लो. And they even mother-in-law is just talking about daughter-in-law, daughter-in-law is talking about mother-in-law. So we are more of the family counselor when we just started the practice as a OBGYN consultant. So you also must be facing many problem about this, and you must be seeing the women health is more than this anemia or PPH or delivery. So the what most surprising moment for you? What you just
Okay.
feel?
Now, honestly, I'll tell you, I finished my MD in 1992, and since 1993, I started working. Initially, I worked in the BJ Medical College as a research officer under ICMR. And there was a project which involved, it was a community medicine based project where we were supposed to visit different PHCs and talk to the medical officers and talk to the ANMs about various aspects of OBGYN. So that was my first exposure to practical aspects of community medicine. I'm sure you will also agree that the kind of teaching we have in medical colleges of a very important subject like community medicine is really not up to it, and then we don't understand the importance. But that was my first exposure to uh, the community obstetrics as such, and that prompted me to present a paper in the AICOG about at-risk pregnancy in these remote areas and how the training of ANMs has made an impact. And the second big impact I would say was in the year 2006. So at that time, Dr. Durusha was the president of FOGSI, and she had collaborated with WHO for training of of OBGYNs in adolescent-friendly health services. And when we were in Mumbai for training, and for 4 days we were talking about adolescent health. The kind of training we received from WHO made us really introspect as to what exactly we were missing. So we got the community medicine aspect of the subject in general, and then we started thinking. I mean, I personally started thinking beyond delivery and episiotomy and C-section, and then that was the first exposure into the women's health field, because we were made aware that OBGYN is not only limited to hysterectomy or a DNC or a vaginal birth or a C-section, but it is also about various phases in the woman's life, say adolescence, and later on, I had an opportunity to learn about menopause also. So these were the times where I really consider myself lucky, because then I was enriched with a lot of information and knowledge about the preventive and community aspects of the subject.
In the process of learning in the PG, in the clinical practice, there must be many moments when you are just thinking, yes, this is my best decision I have ever made in my life. So share any moment, because sometimes when the grieving patients or grieving family, they are just coming to you, just they are saying you are God. Sometimes when you saw you just treated some adolescent girl from some disease, and that time you just feel, okay, this is the exactly where I belong. This is exactly the branch I have done excellent in my work. Any moment you can share.
Yeah, I vividly remember one episode when I was a registrar in the BJ Medical College, and I was doing an emergency, and our lecturer was not in campus. He had some family emergency, and then he had to rush out. And at that time itself, a patient was brought in from a nearby PHC who was full term and who had vaginal bleeding. And then at that time, ultrasound was not done routinely at all in any of the pregnant patients. So we really had to depend on our clinical findings, and we did examine her. She was in shock. We treated her. We arranged blood. We managed her medically, and then we took her up for emergency C-section. And at that time, I was really scared for a moment, because there was no senior person around, and I was the senior most person in the unit at that time. And the feeling that I got was, if I'm not able to manage this patient, nobody in the unit will be able to do it. So by hook or crook, I have to do a C-section, that too properly, so that the patient is safe, and we try and save the mother as well as the baby. And luckily for me, the C-section went off well. It was a case of central placenta previa, but luckily the mother and the baby both were safe, and then they went home, in a good condition. So that boosted my confidence, and then at that time I thought, yes, this is what I want to do, and I would love to do all the time.
I'm asking one question. You have to answer in the two ways. Means one is the serious note, which means really impact on our gynecologist friend, and second in the humor also. What's one thing you wish the world understood about being a male gynecologist?
Now,
Yes, you must be having so many non-medico friends also. You are having a big family. Your kids are now going to marry one kid. I know just recently when your son has got married. So they are a huge family now. So there must be that there is though we are liberated when we all are learned people still, दे आर जैसे फिल्म में भी आ जाती है सर, आयुष्मान खुराना की तो फिल्म ही आ गई थी, सो
Yeah, yeah. So, that particular movie, in fact, Jyoti, I would say that, that would be a good learning experience because we are not supposed to be like that. That is what I would say. Now, see, on a lighter note, whenever the non-medical friend, they always felt that I am always surrounded by women because in my OPD there would be always women. But then they also come up with their health issues and they're there to share their agony. They're there to share their problems, and we have to be very, very patient and try and give them solutions in a language that they understand. So being in the company of women is not fun as far as the OPD is concerned, because you have to be really very, very patient and take care of their physical ailments as well as their mental health needs. So this is one important message for all male gynecologists. And if you when you refer back to the movie, now the first thing that was told to us when we entered the department of OBGYN, and that is what we have followed, is that as a male postgraduate student, I was instructed never to examine a patient without a female attendant.
यस,
So what we were told is that कुछ भी हो जाए, डिलीवरी भी हो रही हो तो भी make sure that there is a lady attendant who's present with you. Of course, a staff nurse or at least an AYA if staff nurse is not around, and then only touch the patient. And that is what is important, because gynecological examination is all about a very personal or a private aspect of a woman. And then unless there is a lady attendant, I never touch the patient. In fact, I don't even enter the examination room unless there is a lady attendant. And in my own practice nowadays, what we've done is that along with a lady attendant, there's additional lady doctor, assistant doctor, who is also there with me. So there are two women present when I'm talking to a patient or when I'm examining a patient. And this is a very important take-home message for all male doctors who are watching this and who intend to be obstetricians and gynecologists in the future.
so this is the you are telling about the deliveries or examination, but how do you build trust and comfort with the patient who is meeting you with the male gynecologist for the first time? Because sometimes when we are working in the corporate hospital, sometimes we are working in the medical college and we are just allotted one unit where we are unit head. So this patient is bound to show that doctor. She is not in the charitable hospital. She is not having say. This is a charitable OPD. The only one doctor is sitting there, and now she has to show the doctor. So how do you build trust and comfort with the patient? There's some
Right.
tips.
Jyoti, I totally agree with you. In the private sector, yes, the patients have a choice whether they want to see a male doctor or a lady doctor. And luckily for me, my wife is an obstetrician. So whenever any patient says that she's more comfortable with a lady doctor, I of course ask her to visit my wife rather than me talking to her. Now, after I joined one of the hospitals after my MD, uh, somehow I was the first male OBGYN specialist in that hospital. Till then, it was a very old hospital, and then there were all the consultants so far were all women. And then at that time, there were almost 30% of women who were not keen to see a male doctor. They always wanted to uh, prefer a male doctor. So, that was again a learning for me, because then I had to prove to the patient my worth. So one thing I did was I started talking to them. I started talking to, I started explaining them in detail. So I was taking a lot more time than other consultants to talk to a patient. Second thing which I did was, in that hospital, there were a few patients who used to speak in Gujarati. And I'm not very confident about Gujarati, but I'd learned few words here and there. And while talking to the patients, I started using those words. So in fact, that also made a positive impact on the patient, and then they felt comfortable. Then they felt that all right, it is okay to talk to a male gynecologist if the female gynecologist is not there. So I think talking to the patient, counseling them, explaining them was something which I resorted to in order to prove myself
Yes.
as a consultant.
So there are the dynamics, they are differing between the male and female gynecologists. Because as just now you said, Vaishali madam is a gynecologist. For our viewers, we are just telling them, Dr. Vaishali Biniwale is the renowned obstetrician of Pune city. So you are saying, miss, there is, you can just see in your home only, there is a dynamics, the difference of dynamics, difference of the patient handling also, difference of the talking to the patient also. So just for our viewers, you can just say this, because when we see, you have to just build trust. Previous means you have to build a trust, you have to make the patient comfortable, then you have to just see for any attendant from your hospital, from the patient side, then only you can say this patient that I am going to examine you. But when Vaishali madam will be doing same thing, she has to just ask 2-3 questions and just has to say कि भाई लेट जाओ अभी तुम्हें देखना है. So there is a difference in the dynamics, but in your own practice, how you feel.
Right. So actually, the thing is, both of us like talk a lot to the patient. So
Okay.
if I talk to a patient for about 5 minutes, Vaishali would talk for about 6 or 7 minutes. So she likes to explain the patient in detail. And then, while explaining the patient, I always have a habit of saying that, you've shown me a report, that's fine, but then I have to do a clinical examination before I, think of any treatment. And now, after 35 years into this profession, there are hardly any women who refuse a clinical examination. There could be one odd person who may not be very comfortable in examination, but then they would only opt for a consultation. Um, so when we are working together, I always feel that her OPD is going to be much more than my OPD. We work at the same time, and it works well because I can do rest of the things. In fact, it so happens that if one of her patients is delivering while she's very busy in the OPD, sometimes I also go and conduct the labor so that the work is done at the in the stipulated time. So that, in fact, that is the understanding that we have when we talk to the patient. Patient knows that mostly it will be Dr. Vaishali who will be there for delivery, but if she's not there, Dr. Parag will conduct delivery. So right from beginning, we've tuned our patients, or we've trained our patients that either of us will be there to attend to them. We may not be present all the time for them. So that becomes really easy.
Uh, But anytime your ongoing patients or your new patient or the patient you are seeing in the 9 months in the antenatal period, or you are seeing just for the any element you are seeing, and that patients openly express discomfort, doctor, now I don't want to show you. And if any as such episodes happen, sometimes patient is showing us and all of a sudden she comes to know that इनकी वाइफ भी गायनेकोलॉजिस्ट है, सो शी इज प्रेफरिंग टू शो वैशाली मैडम, और समटाइम्स शी इज सेइंग मुझे आपको दिखाना ही नहीं है. एनी सच एपिसोड हैपेंड ना सर?
Very rarely, but then if it happens, then I think one should accept it graciously, because ultimately it is the patient's wish, and if she doesn't, if she's not feeling comfortable, you shouldn't insist that you will only, manage her, or you will only examine her. We should respect the patient's choice. So,
Many
but then nowadays it rarely happens. It doesn't happen anymore.
so many a times in our layman means our village ladies or the small town or in the छोटे छोटे what we can say not that much educated ladies, उनका एक फिक्स डायलॉग रहता है, मैडम आपको क्या मालूम हमें कितना दर्द हो रहा है. Even when my son was so small, young, and I used to take him in my OPDs, and sometimes that time PCP, NDT and everything, when we try to just tell them it is not going to happen if you want to sex determination, or if you want to just give a chance for boy to come and you are just delivering every year. That time they say आपको क्या पता मैडम, आपका तो लड़का है. So same thing the patient may say to you also, okay, how do you just ensure empathy just in the field, because you are not undergoing such things, no, not being a female. So you are not having any experience of such things. Like हमको बहुत बार बोलते हैं मैडम आपको तो समझता है कितना दुख रहा है. Just so ऐसा in such episodes what you just say to the patient, because you cannot undergo physically for the same things being a male, but your patients are coming in the antenatal period, in the labor, or even in for the hysterectomy. So how do you just ensure the empathy for such patients? उनके मुंह से तो निकलता है सर कि सर आपको क्या पता है कितना दर्द हो रहा है, सर आपको क्या पता है प्रेगनेंसी में कितनी तकलीफ होती है. Such things they cannot say to the female gynecologist. Such
Right.
things they can say to the male gynecologist. How will you just do the ensure the empathy or trust or comfort from such patients?
Right. So as far as labor pains is concerned, I think we should have our theory very, very clear. Now, you will also agree that the labor pains are equated to the pain that is experienced by a woman during labor is equated to that of a digit amputation or say a fracture. So even if you've not had a labor pain or even a fracture, we can definitely understand the kind of pain the woman must be experiencing. So you have to be really very empathetic to these patients, and that is what I think really matters, because when you give a good ear to the woman, when you listen to her, whatever are her concerns, and then when we try and give them solutions, I think they are definitely more comfortable. Of course, sometimes I have also said that, I have not experienced it, but I can understand by looking at you that you are going through a lot of pain. So I, for one, am a big fan of epidural lumbar analgesia in labor. So if somebody gives me a choice, I would offer it to all 100% women, because the only counseling point I tell them is that if you want to suffer with pain and then deliver, then don't take epidural. But if you want to smile after you deliver, then epidural is a good choice. So I think we have to start uh, understanding the process from the woman's perspective.
Actually, sometimes they are coming with their in-laws, their neighbors, their even friends, and all the girls gang they are coming to your OPD, and then they just utter in between them ना कि इनको क्या समझता होगा या इन्हें क्या, because we are having also the friends who are the OBGYN in our city. In when we are doing the PG, there are few students that, like you said, कि when we all are having we bifurcated the duties in the 3 hours, and sometimes when the male person who was doing the duty, he was just coming, कि Dr. Miss Jyoti just come with me because this patient is alone and a very young attendant with her, so now you have to come with me just to stand there as a companion, because this is a small thing, we have to build trust. Otherwise something happens, the mishap happens, and they just say कि सर को तो समझ ही नहीं आ रहा था, उनको तो कुछ समझता ही नहीं है. This type of things just happens. And actually we are living in the era of the medical legal things. There are so many litigation, and obstetrics and general surgery, these are the two branches. Especially obstetrics is just par. This is a 45% of the cases are just the obstetric cases, because there are two lives involved. First is the mother and second is the baby. So every day we are seeing so many litigation, and from your side, from the male gynecologist side, we have to just see your own reputation. You have to just see some bad allegation should not come to you. So what steps you consciously take? Means just you said me one attendant should be there, and should be, I think CCTV cameras are nowadays each and every OPD corridors, they are having the CCTV camera. But still you have taken few steps in your practice to just make this environment safe and respectful for the woman, because most of the time it is not possible for your wife or your Aya Bai or your nurse to stand in the history writing or when you are conversing with the patient. So what small steps you must have taken in your own practice?
Yeah. So generally what we follow in our clinic is that the history taking is done by our assistant doctors, who are essentially women. So patients are quite comfortable with them. And now we are at an age where the patient comes to you because they want to show you. So, mentally also they are prepared that we are going to see a male doctor. And since we are into practice for a very long time, now we are treating the second generation. So babies who were born uh, at our hands about 25, 30 years ago, and they are the ones now who are coming as a patient. So again, for them, it is the trust with which their mothers or grandmothers have brought. I think that's more than sufficient. But you very rightly pointed out that it is important to take all these measures from the medical legal perspective, because here we are dealing with the patient's private parts. So uh, while talking to them, you should not use any loose terms. You have to talk science. You cannot, I mean, you can explain them by means of charts, or there are interactive videos, or you can draw some diagrams and show them. But then you have to be very, very particular, and you have to be absolutely scientific when you are talking to the patient.
So you are actually very research oriented and very means big academician of means our country and our FOGSI. So sometimes we make videos, sometimes we just obviously we take permission from the ladies that we are going to put this video on the YouTube or for the educational purpose, or we are taking the photograph. Sometimes we have to just see the some unique cases and we take the photographs. But in practice, we have seen when the girls, the ladies, means the female gynecologists, they are putting reels or videos or photographs, the patient, they are not feeling hesitant. But when the same thing is done by the male gynecologist, they all of a sudden they are feeling so bad, they are feeling so awkward, they are feeling so embarrassed. Ki why you are putting my video, why you are putting such things? So is there any measure you are taking to take the consent for those videos or photographs? Because sometimes if we have come across some unique cases, we just make some good paper about it, or we just take good photographs about it. So do you take just some extra thing from this patient in the consent point?
Okay, now if we are doing a surgery which is unique or rare, then we are taking pictures, intraoperative pictures. Say, for example, if we are doing a cesarean myomectomy of a big myoma, then we would certainly take pictures for our own record. Of course, the patient is informed, the consent is taken, and we make it a point not to expose the area beyond the uterus or beyond the lesion. So patient's privacy is maintained, number one. The patient's identity is not, I mean, it should never be disclosed. And somehow we've not made any videos of patients talking about her illness and talking about the treatment that she has received. Somehow I personally don't feel very comfortable in creating such videos. But then these are the pictures which we can use if we are making a presentation. But otherwise, I personally refrain from making any videos and I mean, I've never put any of the videos on social media at all.
There must be some green flags and red flag signs. It's just like the patient, they just choose gynecologist on the basis when they just listen good things in the reviews, good reviews from their fellow, means their friends. Same as a gynecologist, there are the red flag sign for the patient also. In one or two visit, you can understand that this patient is not for you. How you tackle that patient, and as a patient, what are the red flag and green flag sign to choose the gynecologist also? It
Right.
may be
First of
female or male, but in the patient's point of view, what is the green flag or red flag for a gynecologist, and from gynecologist point of view, what is the red flag and green flag for the patient? Sometimes जब पहले या दूसरे विजिट में पेशेंट का अटेंडेंट थोड़ा ग्रम्बल करने लगते हैं, थोड़ा मिसबिहेव करने लगते हैं, दिस इज द रेड फ्लैग साइन फॉर अस कि इनको हमें नहीं लेना है. दो बार तीन बार काउंसलिंग करने के बाद, but being a male gynecologist, what is the sign when you just pick when you don't want to take this patient?
Okay. First of all, let's look at the patient's perspective. Now, for a patient, they have to understand that a red flag is a untrained gynecologist. Now, there are so many people who are not qualified gynecologists, but then they are self-proclaimed gynecologists, and then they can give treatment which is absolutely not scientific. So from the patient's perspective, it is important that they understand that the person, it may be a male doctor or a female doctor, he or she should be a qualified gynecologist,
Qualified and
number
trained
one.
doctor, yes.
Yes, absolutely. The second challenge which the newer generation is now facing is they go by reviews. So Google Pay, they will search for reviews and then एक डॉक्टर को कितने stars मिले हैं, that is also one of the points on which patients decide whether a particular doctor is good or not. I think that is something which is again not correct, because if a patient is not satisfied with the discussion of the doctor or whatever treatment she has received, she will of course write bad reviews. But then there are patients who are satisfied with the treatment that they receive from the doctor. They will write good reviews. So judging a doctor by reviews is, I think, a very, very bad idea. Secondly, the point that you raised, the patient who starts grumbling in the second or third visit, I think we have to give them a choice. We always make it a point to discuss with them that this is my opinion and this is what I feel should be done to the patient. But if it is not acceptable to you, you can take a second opinion or a third opinion, or you can consult any other doctor. I mean, we are very clear on this, because these patients will keep on troubling you. They'll keep on cribbing about any treatment that you give. So again, one very important point is, whenever you are offering any treatment, that explain the patient for example, if you are inserting LNG intrauterine system, where you want to avoid hysterectomy, then make the woman aware that this is one of the treatment options. You feel that this would help the woman. These are the pros, these are the cons. This is how the woman has to do a follow-up. And then if she agrees, you offer her the treatment. If she doesn't agree, then she's free to visit whosoever she wants to. So the choice, again, a good counseling is what we can do, and let the patient decide what treatment she wants to do. So again, this is one important point we must remember.
Actually, most of the time they should actually feel informed, not intimidated. Sometimes we are just imposing our own views on them. We have to just give the basket of choice to them, and whatever they just want to choose, they can choose. Nowadays, see, everybody in our old days, we are seeing auntie ji, kaki ji, mummy ji, and even the patients are saying, "Aap to meri mummy ke jaise hain." When we are students, still the patient says, "Aap to hamari mummy ke jaise hain, dhyan rakh ke delivery karana." So, when the girl to girl or female to female, this type of relationship we just build for the conversation purpose. For the male, it is a bit different to say Didi and Mummy and Auntie. It's a bit different. So you have to maintain your boundaries also, and you have to just offer warmth and reassurance, and you have to also make the human connection with your patient, with their family, because हमारे यहाँ तो बहुत बार हम लोग start when we want to make connect with the patient, we just start. If patient is saying, "Madam, आपकी साड़ी अच्छी," we just say, "आपकी भी बहुत सुंदर साड़ी है. From where you took this? Your jewelry is so good. You are looking so pretty. Which beauty parlor you are going?" We are having also so many things to talk to just make a good connect with the people. So you must be doing same thing to make connect in the different manner. So how do you maintain the boundaries for this talking?
First of all, when you're talking to a patient, you have to get general information. You have to first assess the her work, the education that she has, and then we just get to know about surroundings. I mean, it would be inappropriate for me if I start talking about the sari or beauty parlor. But then I personally feel that we should try and avoid being friendly with the patient, because then they start encroaching onto your personal space. And I distinctly remember one of the patients who wanted to decorate our clinic when it was my birthday, and then she wanted to celebrate it, and she wanted to post it everywhere, which I very politely refused. But then you have to make a distance. You have to have a strict professional relationship. You can when you're talking to them, you can be very cordial, but you have to be professional. And then there has to be a clear-cut line that I'm not crossing this line. I'm sticking to my profession. I'm sticking to my ethics. And then just make the patient aware that there's a certain दोनों के बीच एक दीवार है which will always remain.
Actually, when we are our clinical manual of bedside examination of the patient, whenever still सब हमको रटा हुआ है कि हमने कितना उसको पढ़ा था, they said Every time they said to show the empathy, just touch the patient, hold her hand, her or him hand, and give petting on the means बहुत सारी चीजें थी जो एज ए फीमेल हम फीमेल के साथ कर सकते हैं टू रीअश्योर. Sometimes the patient comes with the miscarriage report or the missed abortion report. She is crying in our OPD and we are just reassuring. So it is actually okay for us. We are doing such things. But being a male gynecologist, if you start doing such thing or something happens, so you have to always think about this medical legal part of it. Because one of my colleague, he has to face this thing, and that was the known case from the Indore, and he was that adolescent girl, he was just reassuring the post rape case, he was just reassuring the girl, and this girl again alleged that gynecologist, and the second case started, and he has to pay a hefty amount to that girl because there was no female attendant with him, and he couldn't prove that he was right that time. So there are so many
So
things
this is again a very important message that you've given, that presence of a female attendant is a
because
must,
we are in
whatever
the
may
age
be a
of
case.
55, 60 is the age. Our own kids are in the same age, 16, 17, 18, 25. Sometimes like these girls coming to our OPD and they are saying, Uncle, ye problem. And we are just thinking just like our own daughter or son. And we are just giving the advices. But we have to be very clear, because if the gender is different from the patient, you have to be very clear about the dealing with the patient. Whatever bad happened to that patient, okay, it is bad thing if something happened to this patient, but we have to always think that we should not do the empathy in such manner of touching or just reassurance in anything that can go against us anytime. Because that girl,
Absolutely.
she
Jyoti, I remembered the training we received during our adolescent friendly health services training. And then here we were for 4 days, we were talking about only adolescents. And one very important lesson that was taught to us was that the adolescent girl has come to you, she's your client. So,
yes, she's
don't
not
get
your
into the
daughter.
parental mode. Don't get into parental mode. You can call beta, beti, etc. But then, you can't go in the parental mode and start preaching, because they are there to seek a professional advice. So you have to make sure that you are the same professional when you're talking to her and looking after her medical conditions rather than her personal
It
issues.
is true for the everyone, sir, not for the male gynecologist. There is a generation, there is a one thing generation gap. Many a times adolescent girls, they are coming for the contraceptive advice. Sometimes they come with pregnancy. It is not our duty to preach them what is right, what is wrong. It is our duty to provide the services she is coming to us. It is our duty to just inform the POXO. We have to just provide the treatment, inform the POXO. We have to do all the things officially, not means once one patient just said to me, Auntie, मेरी मम्मी बनने की कोशिश मत करो. When I started preaching her in my initial days, she said, Auntie, मैं आपके पास पूछने आई हूँ, मेरी मम्मी बनने की कोशिश मत करो. So it happens to the female gynecologist also. So we have to just, when जब से CP आया है, Consumer Protection Act जब से आया है, every patient is our client and we are the service provider, and that is the major thing we have to keep this in our minds.
Absolutely, 100% true.
Yes, so now this is some quick questions for you, sir. There are so many myths you already discussed that सारे फ्रेंड्स सोचते हैं तेरे बड़े मजे हैं, तेरे बड़े मजे हैं, फीमेल्स के बीच में रह रहा है. So one serious, it's a serious, on the serious note, one myth about women health you wish would disappear from forever. It should be disappear.
Now, basically, lack of awareness about their own body. There are so many girls, I would say about 30% girls are really not aware of their body, and then they still find it a taboo to talk about it. So I think that is something that has to vanish now, because we are living in an era where everything is available at the fingertips, where all the information, the scientific information is available. And then there is still something about, a lot of them are not comfortable talking about their own body. So this is something which needs to change actually.
That what should be that one thing you wish every woman knew about her own body? There are many things. You can say BP, you can say hemoglobin, you can say anything, weight. But one thing you wish everyone should know every woman should know about her own body?
They should listen to their body's needs. So, whatever complaints or whatever, problem she has to understand and take help at the right time. So it's not only about a BP or a hemoglobin or even our gynecological conditions, but at the first symptom that they receive from their body, they shouldn't ignore it and they should consult a doctor.
One misconception about male gynecologists that is totally wrong.
Male gynecologists, some people feel that they are adamant, they don't change, but I think most of them are not like that. We probably are more patient than the uh, lady gynecologists because probably we are tuned to be like that.
There is a syndrome, mother syndrome, and every male is tuned to that. So they are listening to their patients also, like they are tuned to everything now. They are tuned to listen to women since the childhood, from mother, then sister, then wife.
Absolutely.
So they are
Absolutely.
more patient, and this actually I also think so. And the most rewarding part of your job in your all your clinical practice, there must be so many patients, but something very special you have seen in your, just like you told, like that cesarean section, that such an
I think we get to experience it every now and then because my personal I am a hardcore obstetrician and I enjoy labor and birthing even today. I mean, even today I don't mind waiting for hours for the labor to progress on its own and then have a vaginal birth. So every time a baby is born, it is rewarding because. A new life is coming into existence and you have contributed to it by delivering the baby safely. So this particular feeling is something which I really cherish every time I attend a birth.
And if not like obstetrician, what would you be like to?
I've not thought about it because the last 35 years I'm into the OBGYN, but then if not OBGYN, probably I would have continued my uh, father's general practice and I would have you know continued the legacy or I would have enjoyed the legacy. But I can't imagine me not attending labor room duties.
There must be so many parags and so many Vaishalis in your chamber whenever the patients are, because that is the fashion that the patients that they like their gynecologist so much. They say, हम हमारे बच्चे का यही नाम रखेंगे, and it is boon to you that Vaishali madam is a gynecologist. So there must be some girls born are Vaishali, some boys born are the parag. So how do you feel, madam, Miss? Is there any rivalry? Is there any professional fights between you? Or just like you said कि जब उनकी ओपीडी ज्यादा होती है, obviously उनकी ओपीडी ज्यादा ही रहेगी. But what is the feeling between you both as a gynecologist, as a companion? Because in my I have seen you when you have taken the charge of ICOG chairperson, that if not me, many people just saw your emotional part, and that time we saw Vaishali madam. She is a strong pillar in your life. She is a very strong lady, very less talking, means not less talking, but फालतू इधर उधर का ज्यादा नहीं बोलती है. So as a companion in our, means we are thinking as a boon, but as a professional, you both are gynecologists. What do you think about this? And as a wife, what do you think about her?
Okay. On a lighter note, I personally feel that no, she's an excellent obstetrician. On a lighter note, I say that if I had some other wife, I would have got her to you for pregnancy care and even for delivery. She has a lot of qualities which I cannot you know have. She's too patient. She talks very very cordially. I mean, and then she has those qualities that she makes a patient very, very comfortable. I personally feel is that our team works well because we know that if I am seeing a complicated case, then I know that there is somebody in the next cabin who is going to give me a ready-made second opinion, and vice versa. And if there is any complicated surgery, I know that there's a equally competent surgeon along with me who will help in managing this patient. So we work as a team, and then it's a win-win situation for both of us, because suppose if one of her patients is delivering, and then if I have to apply forceps, then probably my forceps application would be easier than she applying forceps. Being a male, I'm able to pull the babies out a little better than her. And as far as surgeries are concerned, I think her surgical hand is absolutely fabulous. So even if I'm assisting her, I still enjoy watching her performing surgery. So I think it's a very cordial relationship, and when you work together, it's definitely a big boon to your clinical practice.
So, sir, from when it is time to just wind up all the question answer session, so take home message for our male gynecologist or even our patient who are listening, our people, other people, our fellow doctors. What would you say to young male students who are hesitant to choose OBGYN because of the societal? We are not talking about Maharashtra or Bengal or Odisha, but there are few students who just want to be obstetrician, but they are hesitant of the societal perceptions. So your advice to them, sir?
Yeah. First of all, if you like the subject, go for it. If you are ready to spend late nights or repeated emergency duties in the labor room, if you are ready to do that, then you can certainly choose obstetrics and gynecology. But then don't budge to the societal pressures, because after all, you are there as a doctor and you are treating a patient. So here the gender really doesn't matter. All you have to do is to talk to the patient cordially, be positive, give her good vibes, give her confidence, and you can do that by a good counseling, explaining her what the surgery is all about, or what the procedure is all about, or even whatever changes that are going to take place in a body during, say, pregnancy. So counseling the patient makes things really very, very easy. Unfortunately, there are so many boys and girls who opt for OBGYN and then they don't continue obstetrics. But then for them, I would certainly say that obstetrics is something which is definitely rewarding. And when a newborn is there, then it's definitely a joy which you can share with all your patients and the staff around also.
Thank you, sir. The perspective of the male gynecologist not much different than the female gynecologist. The things are same. The counseling is the same for the patient. The empathy we show towards our patient is the same. But we have to just be careful. Being a male, we have to be careful about just how to examine, whom to examine, and when to examine, and in whom, in the presence of the ayabai or nurse or attendants, ensure the presence of any lady attendant with the cabin or in the labor room. We have to be very careful about talking. Do not to talk so loose. Do not talk unscientific. These are the things, but it fits in the on the female gynecologist also. Now it is not the time that we have to talk loose. To being a female, we can take a liberty of being female and talk loose to the patient. It applies to same to the female gynecologist also.
Sure.
Thank you very much, sir, for this insightful podcast today. And I'm so happy to interview you, because you are the ICOG chairperson. You are so much elated with all the topics, all the academic topic, and so that's why I choose this topic, because as a gynecologist, you are one of the few male gynecologists in FOGSI, which every gynecologist see with the pride that yes, he is Dr. Parag Biniwale, sir. We say yes, he is Parag Biniwale, sir. So nice to interact with you, sir. Thank you.
Thank you very much, Jyoti, for this opportunity, and thank you all.
Thank you, sir, and good night, sir.